We all get scared, right? It's a totally normal human thing. But when does that feeling of fear cross a line and become something more? Today, we're going to get to the bottom of two conditions that people mix up all the time: phobias and panic disorders. They both involve this intense, can't breathe kind of fear. But why they happen? Well, that's a whole different story. So let's break it all down.
So, here's our game plan. First, we're going to get crystal clear on what a phobia actually is. Then, we'll dive into the world of panic disorder. After that, and this is the big one, we'll hit that single key difference that sets them apart. And we'll finish up by looking at how people can get better and, just as important, how you can be there to support them.
So let me ask you this, just to get you thinking. When you imagine overwhelming fear, do you picture it as a reaction to something specific? Like seeing a spider or standing on the edge of a tall building? Or does it feel like something that could just hit you, like a lightning bolt from a clear blue sky? That question right there is the heart of everything we're talking about today. All right, first up, phobias. And yeah, the name comes from Phobos, the Greek god of fear, which makes a lot of sense. But trust me, a clinical phobia is a whole other level of fear than just being a little spooked.
Let's really look at the wording here, because every word counts. The keys are intense, irrational, and specific. This isn't just disliking something. It's an intense fear that is completely, totally out of proportion to the real danger. And most importantly, it's always connected to a specific thing or situation.
And you've probably heard of a lot of these, right? The classic ones like spiders, heights, or tight spaces. But it can be almost anything. A fear of needles, a fear of flying, even a fear of social situations. That last one, social phobia, is basically an intense fear of being judged or embarrassing yourself in front of others.
Now, this is where a simple fear turns into an actual disorder. It's the avoidance. The lengths people will go to avoid their trigger can completely take over their life. I mean, imagine turning down your dream job because it involves flying, or isolating yourself at home because you're terrified of social events. The avoidance becomes the real problem. Okay, let's switch gears and talk about panic disorder. And I want you to pay close attention to that subtitle, the fear of fear itself. That one phrase tells you we are dealing with a totally different beast than a phobia.
So, at the very center of panic disorder, you have the panic attack, this sudden, crushing wave of absolute terror. What makes it a disorder is that these attacks are recurrent. They happen again and again. And the most terrifying part for the person going through it, they often feel like they come completely out of nowhere.
And let's be clear, a panic attack is not just in your head. It's an incredibly physical and absolutely terrifying experience. Your heart pounds so hard you think it's going to explode. You literally can't catch your breath. You get chest pains and might even think you're having a heart attack. You could be sweating, shaking, feeling dizzy. And layered over all of that is this profound, inescapable feeling of doom, like you're about to die or lose your mind. It's your body's fight or flight switch getting flipped for no reason at all.
Now, when you're in the middle of that, it feels like it will go on forever. But here's a really important piece of info. A panic attack usually hits its absolute peak within about 10 minutes. It's an awful 10 minutes, for sure, but it does pass. Knowing there's an endpoint can be a crucial anchor in the storm. And this is that vicious cycle we were talking about, the fear of fear. Because the attacks are so random and so horrible, you start living in constant dread of the next one. So you start avoiding places where you've had one before: the grocery store, the highway, the mall. And little by little, your world just starts to shrink. Okay, we've defined them both. Now it's time for the most important part of this whole explainer. This is the aha moment, where it all finally clicks. Seriously, if you remember just one thing from our time together today, make it this. This is the absolute core of it all. And here it is. It all comes down to this. Was the fear triggered, or was it unexpected? With a phobia, the fear is always triggered. There's a clear cause and effect. You see the snake, you feel the terror. With panic disorder, the fear is unexpected. You could just be sitting on your couch, totally relaxed, and bam, the attack hits. Now, here's a cool little nuance. A person with a phobia can have a panic attack, but it's always in response to their trigger. The attack itself isn't the disorder. The specific, triggered fear is. So now that we can tell them apart, let's shift gears and talk about something really hopeful. How do people get better? The good news is there are incredibly effective ways to treat both of these conditions. And honestly, this is the most important message here. There is so much hope. No one has to just suffer through this forever. Thanks to decades of research, we know that both phobias and panic disorder respond really, really well to treatment.
So what does that treatment look like? Well, it's usually a combination of these three things working together. You've got therapy, which helps to rewire the brain's fear response. You've got medication, which can help manage the really intense symptoms. And you've got lifestyle support, which helps build a strong foundation for your mental health. Therapy is a huge piece of the puzzle, and the gold standard is something called cognitive behavioral therapy, or CBT. For phobias, a therapist might use something called exposure therapy, where you're gradually and safely introduced to your fear until your brain learns it's not actually a threat. For panic disorder, it's more about understanding those physical sensations, learning to challenge the scary thoughts, and using tools like breathing techniques to calm your body's alarm system.
Medication can also be a real game changer. It's best to think of it not as a cure, but more like a bridge. It can lower the overall level of anxiety or reduce the intensity of panic attacks, which then makes it possible for you to do the really deep, long-lasting work in therapy. It gives you a solid place to stand.
Okay, so what if this isn't you, but it's someone you love? A friend, a partner, a family member? This last part is all about what we can do to be better allies.
The most important thing is empathy. Be patient. Please never say things like, just get over it, or it's not a big deal. Because to them, it is a massive deal. If you're with them during a panic attack, your calmness can be a huge help. And this last one is so, so important. Do not try to force them to face their phobia. That's a job for a trained therapist. And trying to do it yourself can actually make things much, much worse. And if you're ever with someone having a panic attack and feel helpless, remember this phrase. Just saying these words calmly can be an incredible anchor for them. You're safe. I'm here with you. This will pass. It's simple, it's grounding, and it's incredibly powerful.
And that's really the whole point, isn't it? Understanding. Once we really get that key difference between a triggered fear and an unexpected one, we're in a much better position to offer real, effective, and empathetic support to the people in our lives.
So, I'll leave you with this final thought. We know these conditions are real, and we know they're treatable. So the final piece of the puzzle is all of us. How can we, in our own circles, make talking about mental health and seeking help for it just as normal as going to the doctor for a cough? It's a really important conversation, and I'm glad we could start it today. Thanks for tuning in.